Good afternoon. My name is Stephanie Sinclair, and I work at the First Nation Health and Social Secretariat of Manitoba in Treaty 1 territory. I'm here today to speak to you about moving into action, successfully supporting the trajectory of our spirit. And this talk is based on work that I've done in the area of research while working to support community-based priorities around restoring and revitalizing Indigenous knowledge around birth and parenting. So the name of our project is called Supporting the Trajectory of Our Spirit, and it is a partnership between Indigenous communities in Alberta, the Blackfoot, as well as Indigenous communities in Manitoba, the Cree, some university and academic partners, as well as community-based organizations, and specifically Withiwei Kwei, which is the organization that was formed in order to develop the birth helper training. The work that I'm currently working on is funded by CIHR, and we're in our second year of this project. This diagram was developed for a project in order to kind of show the representation of the different areas that we're working on. So the overall goal of the project is to restore and revitalize traditional teachings and to promote health and wellness based on our cultural knowledge, not only at birth, but across the lifespan. So I'm going to talk a little bit more about the specific research question. So our research question is designed to look at the impact of colonization and how it has disrupted the transmission of Indigenous birth knowledge and practice. So we want to look at how restoring this will shape health and well-being in the long run. So specifically, how do cultural, spiritual, land-based, and community connection from the time of birth impact the health and wellness of children as defined by our nation? So that is the work I'm working on, but I really want to talk to you today about how did this come to be? So what are some of the foundational pieces that happened in order to support this work? One of the main reasons that we have this research project is because there was a training that was developed by a community-based organization to train Indigenous birth helpers or Indigenous doulas. So this organization started in 2015 and it began with ceremony. It began with a lot of consultations and a lot of meetings and consultations with knowledge keepers and grandmothers within Manitoba. So many of the issues were being brought forth specifically around child apprehension and newborn apprehension, as well as social and health issues like suicide, mental health issues, and chronic health conditions. And one of the ways in which the knowledge keepers and grandmothers advised us is that we must start at the beginning. So we must start by having the strong cultural and spiritual foundations for children from the time of birth. So the birth helper training was developed to improve access to culturally grounded knowledge around birth and in turn improve maternal and child health outcomes. So they started with doing feedback sessions with community members, knowledge keepers, grandmothers, as well as community-based healthcare workers. And they asked questions about the birth experience as it currently existed. And so some of the themes that came out were that birth in a hospital often feels traumatizing or violating. Many recalled experiences of racism and discrimination. They found the system to be paternalistic, and they found that women and mothers did not feel like they had much control over the birth experience, that their decisions were often made based on fear, and they did not often feel that they were informed about what was happening during the birth experience. So women wanted to take back their right to have birth in a sacred way, to have culture, language, and ceremony respected during the birthing experience, to have a supported and loving space. So this initiative came from a community priority to address issues that were coming up and that were of concern to First Nation communities in Manitoba. So the training is based on the fact that we are not creating new knowledge, we are revitalizing Indigenous knowledge that has always existed. So Indigenous people have always known how to give birth and recognize the importance of the first rite of passage, in which a person comes from the spiritual realm to the physical realm with the flow of the sacred birth waters. So the curriculum that was developed is based on the fact that all Indigenous women are midwives or were midwives or had that knowledge. And that what has been disrupted by various policies and practices and the medicalization of birth. So that this training is holistic, and it includes a 5-day comprehensive training in which they go through different areas. It all is based on a spiritual and cultural foundation of knowledge. They talk about what kinds of teachings were provided throughout the lifespan before a woman became a mother. So that's called a life-giving bundle. And then they talk about the things that are needed and necessary when you are pregnant and before you give birth and when you give birth. So the birthing bundle. And then they also talk about afterbirth. What are some of the key teachings around providing care to a newborn and how to embrace that newborn into your family and into your community. So the organization is called Withiwei Kwei, and it was started by 4 Indigenous women in Manitoba. And this is the current board of directors for the Withiwei Kwei, and they are our main community-based partner, other than the Indigenous communities, of course, that we work with. The training that they developed is called the Sacred Circle of New Life, so that every baby born is born into the sacred circle. So the goal of the training is to provide women with the opportunity to learn about the Indigenous knowledge as well as Western-based knowledge around what to expect when you're going to give birth, when you're pregnant, what to expect at the hospital or birthing center. So it does talk about the different interventions that could happen. It also talks about the cultural and spiritual aspects of bringing new life into this world and what can be done to support that. So the goal of the project is to look at creating circles of women to revive the birth and parenting knowledge of Indigenous people. The goal is to lead the return of birth in the community. So many communities do not have a birth center or hospital, so they recognize this is one way in which we can start the process of returning birth to our community by revitalizing Indigenous knowledge about pregnancy, birth, women's roles, etc., and have that be the basis of the foundation for creating that pathway to move forward. They also support families to reconnect with this knowledge, as many families have to reclaim some of what was lost through the disruption from residential school or 60 scoop or medicalization of birth. And then the birth helpers are also a role model for what compassionate, culturally safe care should look like for all women. They are also trained in order to advocate and empower women to reclaim their confidence as birth helpers. As life givers. So many times through policies and practices, Indigenous women don't feel confident in what they already have within themselves. So there's a lot of empowerment that happens within the training. And they're also trained to be an advocate within the Western medical system to support the family in the decisions and to incorporate cultural and spiritual aspects into the birth. So the teachings that the foundation is based on is that the most critical years of life for instilling identity and pride are from 0 to 5. And in order to achieve overall health and wellness, we must work together to restore the sacred bond between parents and their child from the moment they are born. So this work came from the priorities that were identified by First Nations, and it works to identify and support Indigenous identity throughout the birthing process. So I urge you to think about how you can support work with people to use their cultural knowledge and identity to improve their health and wellness outcomes in whatever work you're doing, in your workplace and as you work with patients and clients. So I really want to thank you today for the time, and I hope that we have a very meaningful discussion after this. So thank you so much. Miigwech.